Dr. Pivonka here from Scoliosis East Phoenix in Gilbert, Arizona. In today's video will be about how to recognize the early signs of scoliosis in your children at home, because just doing well visits once a year leaves a lot of room for scoliosis to progress over time. Early detection is absolutely critical in the treatment of scoliosis. So if we look at my slide here, the first thing we're going to look for is shoulder height. And so if we see that the right shoulder is higher than the left shoulder, most typically, then that's an early sign for scoliosis. Also, if we notice that the scapula on the right-hand side, or the shoulder blade on the right-hand side, sticks out more prominently or is higher than the left-hand side, that's an early onset sign. Or if we look at the contour of the muscles and we see that there's a noticeable curvature in the spine and the muscles, that's an early sign. And then next we want to look for hip height. We notice that the one hip is lower than the other hip, typically the left side, then that's an early sign. And then also lastly, we're going to look for the waist angle. If we notice that one waist angle is flat compared to the other side, which will have more curvature to it, then that is also an early sign. If we then put the child in what's called the Adams forward bending position, we can look at the rib contours. So we look up from the bottom, we notice that the ribs on this right-hand side and the middle back are more prominent than the ribs on the left. That's an early sign. And then in the lumbar spine, or the lower back, if we see that the musculature on this left-hand side sticks up higher than the right-hand side, that is also an early sign. Then moving to the side of the child, if we notice that they have a prominent curvature in the thoracic spine here or the lumbar spine, that's early signs of a kyphosis or Sherman's kyphosis in either the thoracic or lumbar spine. If we see these early signs for scoliosis, I definitely recommend that you have your child checked by a scoliosis clinician sooner than later. Early treatment, early detection is critical in some cases. Waiting a year until your next well check is not going to be soon enough. So if you see these, have them checked as soon as possible. If you want to have your child evaluated here at Scoliosis, our phone number is 480-892-0022. You can also look on our website, which is scoliosis.com/east-phoenix-arizona. Again, I'm Dr. Pivonka with Scoliosis, where we provide the right treatment at the right time.